In today's health headlines, how common is appendix cancer? What to know about hot chemotherapy? And how long should people with cancer worry about their diagnosis each day? Joining me is Dr. Kiran Turaga, Chief of Surgical Oncology at Yale Medicine and Assistant Medical Director for the Clinical Trials Office at Yale Cancer Center. Welcome.
Good morning. Thank you for having me.
You bet. All right, we rarely hear about appendix cancer. How common is that? What should we know about it?
You know, we used to think that the appendix didn't have any function. In fact, we used to call it a vestigial organ. And what we've learned is the appendix is actually a very important organ in maintaining both the immune system as well as the microbial environment of the intestine, so the normal bacteria inside it. And sometimes the appendix can get diseased, and appendix cancer happens in around 1,500 to 3,000 people in the United States every year. But what is alarming is that we are seeing this more in younger adults, and quite often we find it at stages where it's already advanced. And so I do think that having awareness about appendix cancer is important, and for us to kind of think about how to treat it well.
Are there symptoms if you have it?
So about a third of patients will present just like appendicitis. In fact, many times patients will have appendicitis, which is pain, fevers, not feeling well, and they end up having an operation. And then on pathology, which is once it's taken out and you look at it under the microscope, you discover the cancer. On the other hand, 2/3 of the time, many times patients will present without any symptoms. It's either found on another scan, or they may find themselves with their abdomens getting full of fluid, and that's usually when it's discovered.
All right. Hot chemotherapy can be performed after tumors are removed from the abdomen. What can you tell us about this treatment?
So cancers like the appendix cancer, but also colon cancer, ovarian cancers, gastric cancer, so many common cancers can spread along the linings of the walls of the abdomen called the peritoneum. You know, I tell patients it's sort of like the wallpaper on the walls of a room. And so when we actually do surgery, we clean out all this cancer. So it's an elaborate, meticulous surgery where we spend hours cleaning out these linings. But once we clean it out, we really want to kill any cells that are floating around. And so that's where we apply hot chemotherapy. It's heated up to about 108 Fahrenheit. So it's quite warm. And it's circulated inside the abdomen for about 90 minutes, where it kills any of the cancer cells. And because we're delivering chemotherapy right where the cancer is, you can give it at high doses with very low side effects.
All right, and finally, and we all have friends that are being diagnosed with cancer. There's so much worry, all the waiting. What can you tell patients about this?
You know, I think as someone who has had family members die of cancer, just like many people who are listening to this segment, you know, cancer is something that makes us all feel a loss of control. We feel that we don't know how to handle this. And I think what my mission and my purpose is to be a quarterback for our patients that have cancer. And I think what advice I would give for patients and their caregivers that are dealing with cancer is to think about it for maybe an hour a day. You know, think about it, process it, make sure you prepare, talk to your loved ones. But then it's very important for us to continue to live life in a positive way with hope, because I think cancer cannot take that away. It cannot take the human out of who we are. And I think that would be the advice I would give everyone is try to keep living your life the best you can and use your treating team as your quarterbacks to help you through this process.
Yeah, it's a tough balancing act. All right, Dr. Kiran Turaga, thank you so much for being with us today.
You're very welcome. Thank you for having me again, Ed.